Hello, good evening. How are you doing? My name is Chris. I'm going to be your RN for today, and I want to thank you again for coming into the office to come in for a wellness check of your little one that's coming in here. And I see that he is now 1 years old and he's meeting all milestone um, requirements up to this point. So that's very good to hear, and that's good news for your young one. But there is one thing that came up in today's appointment too as well that we just want to give you information about. It is a very common respiratory condition that we often see in young children, and this is called croup. Now, you may have heard it before. I believe that you have other children, and you may have experienced this before too as well. This condition, croup, is a viral illness that causes swelling and inflammation in the upper airway, this area, especially around the larynx, the voice box, or the trachea, which is the windpipe, and the bronchi, which is the tubules going down into the lungs. And usually, croup affects children anywhere from around 6 months to 3 years of age, which is why we want to talk about this because your young one is now 1 years old. Yeah, so in most cases, this happens during the fall or winter months too, which is the season that we're in right now. It's appropriate to talk about something like this just in case that you encounter this with your 1 year old. Okay. What is it caused by? It's caused by influenzas like parainfluenza virus, but it can also be triggered by other respiratory viruses. Maybe you've heard of something called RSV. It's very common in young ones. It's something that comes up and spikes up during the winter and fall seasons, the flu seasons. RSV, also known by its name, respiratory syncytial virus. Okay, there's other things too that can cause croup, adenovirus, or just regular old flu strain that comes out every single year. Okay. But here's some signs to look out for and symptoms to notice as well if your child does have croup. One of the telltale signs for differential or diagnosis that you can notice on your own that you may see or even hear is one of the most telltale signs is a barking cough, and it sounds like a seal. Okay. The barking seal cough is what a lot of providers call it. And actually, I'll give you a sample of what that might sound like. I'm just going to share my audio here since we're on Zoom right now. And let me share the sound here. Okay. Um, hmm, okay. So, don't know if you can hear this, but let's give it a try. This would be the sound of croup. Okay, if your child is just breathing in and out, this is what it's gonna very high pitch is what some may call it. Okay, and then here's another thing is the barking cough we were talking about. This is what it sounds like. Yeah, like a seal bark. Okay, let's hear that croup sound again, the barking cough. Yes, there's another clear example too as well. Made me cough too. So that's what you would typically hear as telltale sign as well. You might hear hoarseness of voice. I mean, my voice is a little hoarse. I'm recovering from a cold, so you might hear that too as well. Low grade fever could be associated. So from 100.4, 102.2, it's kind of the fever range that we're looking at. And symptoms usually, typically worsen at nighttime. Okay. Um, when I was serving as a paramedic, which I am right now still, um, usually 2, 3 o'clock in the morning. That's when we get the calls of parents of their child having difficulty breathing, having this seal like this cough that's very bad in the middle of the night. So usually it's around that time, and it freaks a lot of parents out. This is why the education is key, because a lot of times when they call, they're not too sure what's going on. They think that their child is in grave danger or dying, when in fact they might just be dealing with the regular croup. But with that being said, those are the mild signs. Okay, mild cold symptoms. Okay, mild symptoms of croup. Okay, but really, you don't want to. We don't want to get too freaked out here at all. The good news is that statistically, okay, I'll read off some of the things here. It's very mild. Okay, very common, can be managed at home. Okay, here it says 5% of children with croup require hospitalization. Very few. So if your child ever goes through this, okay, it's not something that's terminal. And deaths from croup, very, very rare, extremely rare, especially with access to supportive care like what you're doing now today with your young one. Okay, but still, it's very important to understand when to seek emergency care, when to see when it can be managed at home with those symptoms we talked about, and when emergency services or further care is required. So when to seek medical attention, okay? Go to the ER, call 911, call provider, reach out to professional medical help. Excuse me, for a couple of reasons, which we're going to list, okay? When your child has stridor or that wheezing, almost high-pitched sound when at rest, not just when crying. Okay, it's very loud, very consistent. Okay, we're gonna add on if the temperature is over 104 degrees, last more than 3 days, then you might be dealing with more of a severe infection there. Okay, signs of difficulty breathing, fast breathing, chest retractions where you can see the muscles go inside, on the top clavicle area, here in the middle of the intercostal spaces or in between the ribs, or even seesaw breathing as well with the diaphragm and nasal flaring. If you see those signs, that's a sign of respiratory distress to the point where it needs perhaps more intervention. Okay. Another thing too is drooling. It's another thing that you will see as well where it needs medical attention. The combination of those drooling, trouble swallowing, child becomes very sleepy, confused, just totally off baseline. Another big sign too. This is when you really need to seek medical help is if it's turning blue or gray around the lips, fingernails, centrally or peripherally, any type of blue that you might see with the respiratory distress and with all those other signs, that's a time to call 911. Okay. Even if you're insured, it's always better to get checked. And, as a paramedic, we respond to these sort of calls on a regular basis. So they have exactly what your child will need. So you might ask, what are they going to do? Okay. Well, typically, it might be 2 or 3 o'clock in the morning. Your experiences with your child has extreme symptoms. Okay. Paramedic might come, will come. Okay. And he might do a few things. Or you go to the ER, they're going to do a few similar things when it comes to medication. One of the things they'll give is some steroid called dexamethasone, or maybe even Solomedrol, or perhaps another type of steroid that's given orally or IM by injection, carrying the leg, to reduce the airway inflammation. Okay, so that starts working 6 hours, lasts up to 72 hours around that time. So that's kind of like the long term. Another thing they might give for immediate relief, if it's to that high severity, is racemic epinephrine. So that's usually what the paramedics would give or nurse would give through the provider prescription in the ER. It's basically epinephrine in a nebulized form that creates a mist. Child breathes that in, and that's going to reduce the swelling, open up the airways, okay, and help with the work of breathing, okay. So that's what they would give. So at-home care tips when it comes to croup. When managing at home, when you don't see any of those severe adverse reactions, humidity is key, especially in the wintertime. We got our heat running indoors. The humidity is very low. Okay. The mucosa, lung tissue, very high levels of high possibility of dehydration, drying out the mucosal membranes. That can cause a difficulty of breathing. That can cause one of the factors for causing croup. Okay, so keeping your child hydrated, water, Pedialyte, warm chicken or bone broth or some sort of broth. Okay, rest and staying calm. Crying definitely makes it worse. Okay, over-the-counter drugs. You might want to avoid those cough medications in young children unless instructed by the provider. Okay, so calm is very important. In fact, some paramedic protocols mention that if a child does not remain calm, that respiratory distress from croup could actually get worse. So being calm, being very patient in the moment, have a nice tone of voice, and not freaking out. Okay, because if I were a parent and I saw my child at that 3 o'clock in the morning and I'm discombobulated, I would definitely feel um, panicky too as well. And we want to make sure that we stay as calm as possible. So knowledge is power. Without knowledge of the information of what Croup is about, that can cause fear. This is why I want to equip you with the knowledge of what Croup is about. And if they do experience this, especially during the winter time, flu season, there's a possibility because Croup can be common. Croup is something that is not a rare thing. See this in the ER all the time on a yearly basis, a month, winter basis. So I just want to make sure that you understand that. Okay. So do you have any questions at all about crew? Well, thank you very much. I know this is a lot of information to take in, but you've got this, and we're here to help.